Okay, today I'm going to be doing my head to toe assessment. Before I enter the patient's room, I'm just going to check her electronic health record, make sure that she doesn't have any new or previous orders I need to look at, and then also look at her lab values. Before I enter, I'm also just going to look at the door and see if there's any door markers for PPE or anything, but there's not, so we're able to go in. Okay, I'm going to shut the door for privacy. Hello, Audrey. I am Kylie, and I'm going to be your nurse today. Could you please tell me your name and date of birth, please?
Audrey Zadunich, 10/26/05.
Okay, perfect. And then can I just see your arm and wristbands just to do as my two identifiers? Okay, perfect. Thank you. So what brings you in today, Audrey?
I just have a really bad stomach ache.
Okay, is there anything that makes the stomach pain worse or better?
Not really.
Not really? Okay, and then what does the pain feel like? Is it like a sharp, dull, achy, stabbing pain?
Yeah, like a constant aching pain.
Okay. Can you please show me on your stomach where the pain is, or just kind of tell me?
Yeah, it's like around here.
Okay. I have this pain assessment tool that I'm going to use. 0 would be no pain, 10 would be the worst pain. Can you just let me know where you're at?
About a 6.
Okay, thank you. And then when did this pain start?
A week ago.
Okay, thank you. My patient is alert and awake and she's responding well, and then now I'm just going to check if she's oriented or not. Okay, Audrey, do you remember my name?
Kylie.
Okay, do you know where we are right now?
We're in the sim lab of the Casey Center.
Okay, and then do you know the date today?
It is July 11th, 2025.
Okay, perfect. So my patient is oriented and she responded well. I didn't notice any abnormalities or anything, and now we are just going to check her pupils. I'm just going to check the size of them first. Okay, that one is 6 millimeters. That one is also 6 millimeters. Okay, and I'm just going to check pupil constriction. Good. And good. Okay, so I didn't notice anything like any facial droopiness or anything, and then my patient is, talking well, speech is good, everything like that. If she wasn't, then I would just do the glaucoma scale to just figure out if anything was wrong. Okay, so now I'm just going to take this off real quick. Okay, so her skin looks good. It looks warm, it looks dry, pink undertone, tan skin. Her body alignment also looks well, it looks symmetric. Doesn't look like there's any need for care or anything. Okay, Audrey, I'm just going to test your muscle strength, okay? So can you grab these 2 fingers and squeeze them as tight as you can? Perfect. And then can you put your hands against mine and push against me for resistance? Perfect. Could you go like that with your hands, please? Pull against you. Good. Now, can we do the same with your feet? Can you push towards me, please? Now, bring them towards you. Perfect. And then can you lift this leg up for me? Good. And then this one? Okay, perfect. Are you having any numbness or tingling at all in your toes, hands, or just anywhere on your body?
I don't think so.
Okay, perfect. Now I'm just going to take your temperature, and I'm using the temporal thermometer. Temperature is 97.6. And then now I'm just going to estimate your blood pressure, your systolic blood pressure. Thank you. Just make sure it's fitting well. And then since she is an adult, I am just going to use the adult arm size cuff, but then I would just make sure that it fits properly for her. Audrey, you'd be able to just hold this for me, please? Thank you. I'm just going to feel your brachial pulse. Perfect. And your systolic was at 100. So when we do your regular blood pressure, I'm just going to add 30 to that for your systolic. Perfect. Now I'm just going to take your pulse oximetry. Just make sure it's on first. Perfect. You can just rest that down there. Do you have any plans today at all?
I don't think so.
Not today, just the stomach pain's kind of Getting worse?
Yeah.
Okay, and your pulse oximetry was at 99. Now that we gave your arm a little bit of a break, I'm just gonna do your actual blood pressure now, okay? Same thing on the same arm. Perfect. Would you hold this for me again?
Yes.
Thank you so much. And I'm just gonna listen with my diaphragm. Perfect. And for blood pressure, I got 108/74. So that looks good. And then now I'm just going to listen to your respiratory.
Okay.
Actually, first, I'm going to do your apical pulse.
Okay.
I'm going to listen with my diaphragm for 1 minute, okay? Perfect. So your respiratory rate was 14 and it was unlabored. And then your apical pulse was 60 beats per minute, which is regular. Okay. Perfect. And then I'm now going to listen to your lungs in the front in 6 different spots. Do you have a cough at all?
I do not.
Okay. Also, if she did have any like oxygen mask or like anything like nasal wise, then I would just make sure that those are working regularly and that the flow rate is right on those. And then if she did have a cough or any wheezing or anything, then I would just make sure that I would use a incentive spirometer for her, just to make sure that, you know, she can help breathing. But since she doesn't, we can just listen to her. Can I have you sit up, please? And then can I also have you breathe in and out through your nose, or through your mouth, sorry.
Okay.
Good. Good. Now I'm just going to listen to the back and just do the same thing for me. I'm going to be listening to 4 different spots on the back on each side, so 8 in total. Okay, just 2 forward. 2 more for me. I'm gonna check the side. Good. 1 more. Good. I didn't hear any crackles or weasels or anything, or wheezes or anything, so those sound good. I'm now just gonna listen to your heart for you, okay? And I'm gonna listen to the bell, or with my diaphragm and then the bell, just so I can hear if you have any murmurs or bruits or anything, but I'm gonna listen first. I'll listen to the aorta first. And I'm listening to the pulmonary. And I'm listening to Erb's point. And listening to tricuspid. Okay, and I'm just going to listen last to your mitral valve. Okay, everything sounded normal. I heard S1 best at the apex, S2 best at the base, so didn't hear any bruits or murmurs or anything, so that all looks good. Now I'm just going to be checking your pulses. I'm going to check on the feet, on the tibia, and then on right here as well. Check your feet first. Okay, good. Those are active in 2+. Good, those are active in 2+. And then now I can see your radial pulse. Thank you. Okay, active in 2+. And then now I'm just going to check if you have any swelling, edema, or anything, and just feel for that. Just going to feel your arms too. Okay. Don't feel any swelling or edema. If you did have any swelling or edema, I would just make sure that for DVT, if you had any, machines for that they were working properly and that they were turned on, just so that, they can help with the flow rate. I'd also make sure that if you had an IV right now, that the circulation be running well, the flow rate, that it was at the right speed, and that you weren't in pain or anything like that, okay?
Okay.
Perfect. Now I'm just going to be checking your skin, okay? Just going to feel, pull up. Okay. Skin is intact. I'm going to just feel with the back of our hands on her. She still feels warm. It's dry, tan skin. Okay, perfect. And then since she doesn't have any like skin lesions or anything, or pressure ulcers that I can see, I don't need to do like a scale for that, but if I were, I would just do the Braden scale just to make sure that we could get that worked out for her. I would also make sure that she was having pressure ulcers from laying down if she was like on bed rest or anything, that we would make sure that we could create just like a churning schedule for her just to prevent those, but she doesn't have that, so that looks good for her. Okay, perfect. Now I'm just gonna look at your abdomen, check out the stomach pain that we're having. I'm just gonna put your bed down, okay?
Okay.
Is that comfortable for you?
Yes, thank you.
Okay, perfect. I'm first just going to inspect your abdomen at the side. It looks flat and the contour looks good. I'm now just going to listen. I'm going to start in the right lower quadrant and then just work clockwise, okay?
Okay.
Okay, good. So there were bowel movements, all active in all 4 quadrants. And now I'm just going to palpate your stomach at all. And I want you to let me know if you feel any tenderness or pain or anything while I'm touching you, okay?
It's a little tender.
A little tender right there, and that's kind of where you're having that stomach pain, right?
Mhm.
Okay, in the left upper quadrant. Okay, perfect. So the patient stated that she was having some tenderness in the left upper quadrant. I didn't feel any tenderness, but I will just make sure to let them know. Okay, I'm now going to bring you back up, okay?
Okay.
And are you having any nausea at all?
No.
No? And then how is your diet? Is it okay right now?
Yeah, it's fine.
Okay, so since her diet's well, I don't need to change that or anything for her. Okay, perfect. I'm also going to have you do this Bristol stool scale. Are you having regular bowel movements?
Yes, about
Okay.
once a day.
When was your last bowel movement?
It was yesterday.
Okay, good.
And I would say type 3.
Type 3? Perfect. Thank you. And then when you go to the bathroom and pee, are you having any changes in that? Are you going regularly?
Yeah, I go regularly.
Okay, have you noticed a change in color at all?
No, it's just light yellow.
Light yellow. Any change in odor?
No.
Okay, perfect. And then are you having any urinary retention where it just kind of feels like it's sitting up there?
I don't think so.
You don't think so? Okay. If she was having urinary retention, then I would just use like a bladder scanner just to make sure everything's looking okay. But since not, we are good. Perfect. I'm just going to come back up here. And then how is your mobility at home?
I move around fine.
Move around fine. Do you have like someone that helps you? Do you use like a walker, cane, or anything?
No, I'm okay.
Okay. If our patient did have trouble with mobility or anything, we would just use the Morse scale just to help her with that, just moving around and things like that. But seems to be doing good. I'm going to make sure her bed is all the way down. Looks like it's all the way down. I'm then just going to move over to this side and just make sure that the bed is locked. And then all the rails are down on this side, and then she has those 2 rails up. And then your collet is right on the right side of you. Are you able to reach that good?
Yes, I am.
Okay, and are you comfortable the way you're sitting right here as well?
Yes.
Okay, perfect. Well, Audrey, is there anything else that you need from me today?
I don't think so.
Okay, well, thank you so much for letting me do my assessment on you, and I hope that we can get that stomach pain figured out.
Perfect.
Okay.
Thank you.
Yes, bye.